The streets of Kenya's capital, Nairobi. Tuesday morning, October 7, 2025. Cancer survivors, caregivers, and stakeholders take to the streets, marching towards the Social Health Authority SHA offices.
SHA is not working for cancer patients, not my words, but the words of the patients themselves and their caregivers who are protesting today, and they want the cancer financing issue to be looked into. Let's just hear what they have to say on their treatment journey.
I'm saying as cancer patient, and I am one. I lost my breast, this one, through breast cancer, and I can even remove it. I don't fear. But look at what is happening to our people. Our people are being told to go and wait. Their card has depleted and they are on treatment. How can you halt treatment for somebody to go and wait for another financial year? Cancer is not waiting. Cancer is not waiting. It continues to kill our people. And what is the need of having this if it cannot cover our people? In these hospitals that we are having here, people are dying for no good reasons. And what is the need of having hospitals if we don't have medication and we cannot finance? Lazima SHA iwork. I was treated with NHIF. Ilinilipia kila kitu, kukatwa matiti, kufanya radiotherapy na kufanya chemo. Na ilikuwa na 600,000. Tulikuwa tunalia iongezeke ifike at least 800,000. Badala ya kuongeza, Kenya wamefanya, wameifinya. Ikaenda 400. Surely, we don't want people joining WhatsApp group to contribute for people. We want treatment to be available and affordable for everybody, and treatment to be accessible. Hapa tunasema lazima SHA iwork.
The burden of like 44,000 new cancer cases and the cost of treatment means we are not doing enough. There are far too many out-of-pocket expenses that cancer patients must meet on their own, including a lot of blood works and various tests that are required between the chemotherapy. But the biggest challenge is the fact that if the cover is for 550 per household, unlike NHIF, which was per individual, means that a household can exhaust their SHA within 3 months. And the Chronic Diseases Emergency Fund hasn't kicked in. It's not clear what mechanisms are available to enable patients transition to that chronic diseases fund. So what is happening now is that you exhaust your cover maybe in 3 months or 6 months, and you have to wait until the next financial year, meaning that you either miss your treatments or you dig deep into your pockets.
There are many patients who are suffering. The limit that has been put there of 400,000 is not enough. So cancer patients reach that maximum, and then they have nothing to do because they are now supposed to meet their own cost of treatment, something that is bad. And many of them used to go even out for treatment and they could be catered for. But this time, once somebody is sick, that person is left on their own, so long as they've reached the maximum 400,000, which is something very small when it comes to cancer treatment. So we are saying here that cancer is a very bad thing. It is really eating up so many people in our country, and therefore we are supposed to ensure that we put measures in place that are going to help our patients, our sisters, our brothers. And nowadays you find even many children are also suffering, and families are having a lot of problems.
Among the protesters is 𝗪𝗁 Nzuki, who has lost 2 relatives to cancer.
I am a caregiver. I've had 3 patients in my life who have had cancer. I will start with my mother, who got multiple myeloma, and we discovered when it was too late, so she died in India. NHIF covered part of the treatment. It was giving us 500,000 at that time. That was in 2018. At the same time, I also discovered my husband had cancer, stage 4 also, and we all went to India together. Fortunately, he was also given a cover. Now, when I was a contributor and he is a contributor, so each one of us was given 500,000. We were able to cover our treatment with no problems. After that, I got my brother-in-law, who is also unfortunately died last year in Kenyatta Hospital because there was no enough money for treatment. Not only that, there was a lot of mishaps that were happening, and unfortunately I lost my brother-in-law. Until today, my husband is a survivor of cancer. We have been using that NHIF. I have been paying, he has been paying, so we basically have been getting 1M, both of us being contributors. The other day, I went to the 𝗂 office. I was told that I had finished my 400,000. I was supposed to go for a PET scan. Not me, my husband was supposed to go for a PET scan. I went to KU. I was told also that it cannot cover for me. I came here to the offices because I was aware I'm entitled to 150,000. I was given a letter, which is an official letter, and I wrote a letter to plead that I be considered for 150, the 𝗓, and it was declined. I had to go and sell my piece of land to be able to continue the treatment, which is the first time I have done that from 2018.
Now this issue of 𝗓 is not even working completely. Because now when we registered my mom and we wanted to register also my dad, 𝗓 refused that you cannot register both of them. That you register only one person as a household. You know, it's not like NHIF. NHIF, you could register my mom and you register my dad and it could work. So it could serve my mom differently and my dad differently. But now with this issue of 𝗓, it's one household. You cannot do for my mom and then you do for my dad in a different account. So since we registered 𝗓, I think it has been so hectic because now my dad has a chronic disease and my mom. Because now, when they were doing treatment, for the last 2 months, they said that we've exhausted the amount that 𝗓 gave us. That's $500,000. So since then, we've been spending cash treating my dad and my mom, which is so hectic.
Their key demands.
Number one, reduce an inadequate cancer benefit package from 600 to 400. It is not enough. Yes. Number two, bureaucratic delays and system failures. Unaambiwa expired. Unaambiwa you don't have money. We do not want that. We want a system that is working. Number three, punitive premium financing model. Patients wanaambiwa ya kwamba walipe for 1 year. They don't have money to pay for 1 year in advance. Yes. Number four, poor communication and lack of transparency. Hatujui oncology package iko namna gani. Hatujui balances zetu ziko namna gani. We want transparency, tujue nini inaendelea. Yes. Number six, facility level failures. You go to the hospital, unaambiwa ununue form. Kenyatta unaambiwa ununue form for 40 shillings, alafu ufanye photocopy, alafu unaambiwa ujipigie simu 𝗓 ili waweze kuaddress your issues. So we want them to address the issue of facility level failures. Number six, service suspensions due to pending bills. Kuna wale who are under the private facilities, they did not get the services they needed because of 𝗓 not paying. Yes. Lazima 𝗓 walipe the private facilities. Yes. Number seven, inflexible benefit design. Cancers are different. Na kwa hivyo kila cancer, their charges are different. So we don't want a uniform oncology package. Yes. It has to be tied. Number eight, overseas treatment policy changes. Tuliona ya kwamba the government is making some new policy without consulting, and we want that to stop. Yes. And the funding of 𝗓 funds. Ukiangalia, for example, the primary health care fund received 4.1 billion against Kenya shilling 61 billion. The emergency chronic and critical illness fund got 2 billion against 107 billion requirement. So where will this money come from to take care of our critical and patients? We want to be told. And then emotional and mental strain. Oh, yes. We have enough dealing with our disease, and this is taking a lot of toll on us. So because of that, we miss treatments. We reject approvals are rejected. We have patients who are abandoning treatment because 𝗓 is not working for them.